A bill that would allow psychologists with additional training to prescribe mental health medications passed the House this morning.
So this proposed law passed easily, a 56-6 vote, getting hearty bipartisan support. 9 News reporter Courtney Yoon's with us now. And Courtney, you spoke with people saying that this will help improve access to mental health care.
Yeah, that's right, Tom and Kim. I spoke with a mother of a son with schizoaffective disorder today, as well as a pediatric psychologist who say there aren't enough psychiatrists in Colorado to meet the need. Right now, only psychiatrists can prescribe medication for mental health issues. Wait lists to see one are already long, and psychologists and families say their loved ones don't have time to wait.
The average wait list to see a psychiatric provider is 3 to 6 months on a good day.
For children, the wait list is even longer if you're lucky enough to find one taking new patients.
But the reality is that these kids are not getting the help they need. And so what ends up happening is that their mental health concerns continue to escalate.
Dr. Jin Lee is a pediatric psychologist in Inglewood.
And I've also seen a lot of suicidal adolescents.
According to the CDC, suicide is a leading cause of death for children in the U.S. Dr. Lee says families and patients don't have time to wait for medication if it's needed.
The question is, do we need to wait until that, magnitude of the problem to do something about it?
There's simply not enough licensed psychiatrists in the state of Colorado to be able to serve those with a mental illness.
Sylvia Taz says her son, who lives in Colorado, has a significant mental illness, schizoaffective disorder.
He was about to run out of those meds in 2 days' time.
He moved to a group home and had to switch psychiatrists, but he couldn't get an appointment quick enough. Luckily, his former psychiatrist took time during their vacation to renew the prescription.
Not everybody has witnessed what happens when a loved one with a mental illness goes off their medications, but it can be very, very disturbing. It can even be scary for some.
In order for her son and others to remain stable and healthy, she believes psychologists with additional training should be able to prescribe medication. It's something Dr. Lee hopes she'll be able to do soon, too.
We're in crisis, and we need to do anything and everything we can safely and effectively to help the community.
Dr. Lee says if this bill were to become law, prescribing psychologists would not work alone. They would work in collaboration with their patient's primary care doctor. Psychologists would also need to complete a 2-year postdoctorate master's degree in clinical psychopharmacology. Representative Tammy Story voted no on the bill today. She cited concerns on, quote, reduced foundational medical training and limited clinical hours compared to others with prescriptive authority.
Well, just trying to lower that bar to make it more accessible anyway. It certainly is worth talking about.
Mental health crisis, no doubt. And there's got to be some other options out there. So we'll see. All right. Thank you, Courtney.